Your grandmother kept a cabinet full of medicines. Not a single one of them came from a pharmacy. Every one of them worked. And today, most of them are banned, restricted, or erased from every American medical textbook. This is not an accident. For thousands of years, humans healed with plants, minerals, and fermented foods, passed from grandmother to mother to daughter in an unbroken chain. Then, in the span of one single century, all of that knowledge was replaced by patented molecules sold by 12 corporations. Those same corporations now generate over $500 billion a year in the United States alone. Healing with a root from your garden is very bad for that business. So the knowledge was erased, deliberately, systematically, and with the full cooperation of the institutions that were supposed to protect you. Erased from the medical schools, erased from the pharmacies, erased from the very language of what the industry now calls evidence-based medicine. But the remedies themselves could not be destroyed, only the memory of them could. But they still exist. Some of them are on the shelves of every drugstore in America, relabeled, repriced, and forgotten. I collected 25 remedies our grandparents used every single day before Big Pharma took over. And number 17, I need to tell you this right now, is still in use inside American intensive care units today, at 500 times the price your grandmother paid for it. By the way, Margaret is 62 and took sleeping pills for 9 years. On the 14th day following the sleep protocol inside the Green Vault, she slept through the night for the first time in nearly a decade. She did not find that protocol at her doctor's office. She found it in the link in the description. The community inside the Green Vault counts thousands of members who refuse to accept that you are just getting older is a medical answer. Every one of the 25 remedies I'm about to name is documented with sources inside the vault. Anyway, between 1900 and 1960, every major American medical school phased out the teaching of herbal medicine. It was called, at the time, standardization of scientific practice. Behind closed doors, it was called something else. In 1906, the Pure Food and Drug Act was signed into law. On paper, it protected consumers from poison patent medicines. In practice, it gave the newly created Food and Drug Administration the power to decide what was medicine and what was unapproved. And if a plant had no patent, because nature cannot be patented, no corporation would spend $100 million to get it formally approved. So the plants became unapproved. And unapproved, in the language of the American regulatory system, is extremely close to illegal. Most of what your grandmother used would technically violate at least one Food and Drug Administration labeling rule if sold today, with any health claim attached. This is why they are called, with a bitter kind of accuracy, illegal home cures. They are not illegal to use. They are illegal to talk about as if they worked. Let me show you what's really happening. At some point in the last few years, you left a medical appointment with a new prescription and the unmistakable feeling that you had not been heard. That was not an impression. That was the system, 7 minutes per consultation. In that time, sleep, nutrition, herbs, preventive protocols, root causes, none of that fits. A prescription fits. Nearly 40% of Americans over 65 take 5 or more medications simultaneously. Doctors have a name for it, polypharmacy, a disease caused by medicine itself. The pharmaceutical industry generates over $500 billion annually in the United States, with chronically sick people, not with healthy ones. There's another path. It has existed for generations in integrative and traditional medicine. Specialists with decades of clinical practice developed exact protocols: plant, dose, timing, combinations, contraindications, drug interactions, for the 8 most common problems in people over 45: sleep, pain, blood sugar, kidneys, liver, hormones, immunity, metabolism. Over 50 complete guides, verifiable sources, a community of thousands of members, new protocols every single month, quarterly webinars with practicing specialists, for less than the cost of 1 single hour with a private specialist per year. Link in the description or scan the code on screen. Continuing. And now, the 25 remedies. Number 1, willow bark. The bark of the white willow tree, Salix alba, contains salicin, the exact compound that Bayer isolated in 1897 to create aspirin. Your great-grandmother chewed willow bark for headaches, fever, and joint pain. She paid absolutely nothing for it. When Bayer synthesized it, they sold the first bottle of aspirin for $1 in 1900. That same molecule today generates several $billion a year for its manufacturers. The original plant is still there, still works, still free. Number 2, raw garlic. During World War I, British field hospitals ran out of antibiotics and used raw garlic poultices on infected wounds, and reported survival rates that shocked the medical establishment. Research published at Washington State University in 2011 found that Allicin, the compound released when you crush garlic, was 100 times more effective than 2 common antibiotics against certain resistant bacteria. Number of patents filed for raw crushed garlic: 0. Number of physicians in the United States who will prescribe it, also 0. One more thing. Every single year that passes without the right protocol is a year your body works against you. Not because it aged, but because no one ever gave you the right instruction. Green Vault. Link in the description. Continuing. Number 3. Onion syrup. Layered raw onions with honey or raw sugar left overnight in a covered jar produce a dark syrup that opened the airways of nearly every child with croup for 3 full centuries. The University of Cordoba published a study in 2016 confirming that the quercetin content in onions is genuinely bronchodilatory. Pediatricians today prescribe a synthetic bronchodilator. Your grandmother peeled an onion. Number 4. Raw honey. Medical grade. Manuka honey is currently FDA approved as a wound dressing inside American hospitals. Every other variety of raw, unfiltered honey has nearly identical antibacterial properties. Documented, studied, verified. Your great-grandmother covered burns, cuts, and open ulcers with it. In 2017, the Cochrane Review concluded that honey reduced wound healing time compared to standard conventional dressings. But honey is classified as a food, not as medicine. Even when it heals better than the ointment you just paid $90 for. Number 5. Apple cider vinegar with the mother. Fermented apples produce acetic acid, the same acid shown in a 2004 Arizona State University study to lower post-meal blood sugar spikes by 34% in insulin-resistant subjects. 1 teaspoon before meals, a bottle costs $3. A prescription diabetes medication producing the same physiological effect costs $400 a month. Number 6. Mustard plasters. A paste of ground mustard seed, flour, and water applied directly to the chest for bronchitis, pleurisy, and deep congestion. The mustard releases allyl isothiocyanate, which increases local blood circulation to the lungs and breaks up stuck mucus, used in virtually every American household before 1950, and in exactly 0 American households today. Number 7. Castor oil packs. A flannel cloth soaked in cold, pressed castor oil, placed over the abdomen with a heating pad for 1 full hour. Documented use for liver congestion, chronic constipation, and severe menstrual cramps in Ayurvedic medical texts for more than 3,000 years. A 2011 study from the Mysore University for Science and Technology confirmed a measurable increase in lymphocyte count in subjects using castor oil packs over 7 consecutive days. 1 bottle of castor oil, under $10, lasts 6 months of daily use. Number 8. Cayenne pepper. Dr. John Christopher, an influential American herbalist of the 20th century, documented multiple cases of internal hemorrhage stopped with a single teaspoon of cayenne in warm water. The active compound, capsaicin, is now sold as a prescription cream for nerve pain at $80 a tube. The pepper itself, in bulk, costs $2 a bottle. Number 9. Turmeric root. Curcumin has over 12,000 PubMed studies documenting anti-inflammatory activity, making it one of the most studied natural compounds in modern medical literature. No patent possible. The plant itself cannot be owned. Your grandmother simmered fresh turmeric root with black pepper and ghee. The exact combination that modern research has now confirmed is absolutely required for bioavailability. She knew it without the research because her mother knew, and her mother before her. Number 10. Ginger root. The American College of Obstetricians and Gynecologists officially recognizes fresh ginger for pregnancy-related nausea. It also treats chemotherapy-induced nausea more effectively than 2 common prescription anti-nausea medications, according to a 2012 University of Rochester study. 1 root, a few cents per cup of strong tea. Number 11. Echinacea tincture. The Plains Indians used Echinacea purpurea for snakebite, severe wound infection, and fever for at least 3 centuries before European settlers documented it. By 1920, it was the most prescribed botanical in American pharmacies. By 1960, it had been quietly removed from the official United States Pharmacopoeia, replaced by synthetic antibiotics that could be patented. It is still sold as a supplement. The Food and Drug Administration prohibits its bottle from saying what the plant actually does inside the human body. Number 12. Elderberry syrup. A 2016 Griffith University study in Australia found that elderberry extract reduced the duration of influenza symptoms by 4 full days on average. That is more effective than Tamiflu, which costs $150 for a 5-day course. Elderberry syrup, homemade, costs about $12 and lasts an entire flu season. Number 13. Mullein leaf tea for Bascom thapsus, the fuzzy gray-green plant growing in every abandoned field across rural North America. Steeped as tea, it was the universal remedy for chronic cough, bronchitis, and even early-stage tuberculosis in rural America up until 1940. Modern pharmacological research confirms that its saponins and mucilage directly protect and soothe bronchial tissue. And Big Pharma has no synthetic equivalent, so mullein is simply not mentioned anywhere in modern medicine. Number 14, slippery elm bark, Ulmus rubra. The inner bark, powdered and mixed with warm water, forms a healing mucilage used for ulcers, sore throats, and severely inflamed intestines. The United States Food and Drug Administration still approves slippery elm lozenges as an over-the-counter demulcent, making it one of the last botanical remedies with any official federal approval. Almost no one under the age of 70 knows slippery elm still exists. Number 15, valerian root tincture. Valeriana officinalis has been used for insomnia and anxiety since the time of Hippocrates, roughly 2,400 years ago. Multiple meta-analyses, including one published in the American Journal of Medicine in 2006, confirm it improves sleep quality without the cognitive impairment produced by benzodiazepines. Benzodiazepines generate several billion dollars a year. Valerian tincture costs $10 a bottle and lasts 3 months. The fact that it works is considered, in commercial terms, extremely inconvenient. Number 16, chamomile compresses. Warm compresses soaked in strong chamomile tea, applied to swollen joints, inflamed eyes, and raw skin rashes. The flavonoid apigenin, present in Matricaria chamomilla, has well-documented anti-inflammatory and antihistaminic activity at the cellular level. Your grandmother used it without ever knowing the word apigenin. The effect was identical. Number 17, Epsom salt, the one I promised you at the very beginning. Magnesium sulfate, dissolved in a warm bath, is absorbed through the skin and delivers ionic magnesium directly to muscle and nerve tissue. It remains, to this very day, in active use inside American intensive care units for eclampsia, severe asthma attacks, and certain cardiac arrhythmias. Inside the hospital, administered intravenously, it costs several $100s per single dose. At any drugstore, a 5-pound bag of the identical compound costs $6. Same molecule, same mechanism, different name, different price, different access. Number 18, bone broth, long-simmered animal bones. Release gelatin, glycine, proline, glucosamine, and mineral salts directly into the cooking liquid. Used across every human culture for centuries to treat joint pain, chronic digestive issues, and slow recovery from serious illness. Dismissed for decades as mere folk nutrition, until the Cleveland Clinic itself began recommending it for post-operative recovery and leaky gut syndrome in the 2010s. Number 19, fermented cabbage, sauerkraut. Central to German, Polish, Russian, and Ukrainian diets for at least 6 centuries. It contains lactobacillus strains identical to those sold today as prescription-grade probiotic supplements for $50 a month. The standard American diet eliminated fermented foods in essentially one single generation, and autoimmune disease rates doubled inside the same window. Researchers at Harvard are now publicly connecting the two. Number 20, clove oil, eugenol, its active compound, is a local anesthetic strong enough that dentists still routinely use it for temporary dental pain relief before tooth extraction. A drop of pure clove oil on a painful tooth, pressed into the cavity with cotton, will numb it completely within minutes. Documented in every household medical reference book printed before 1930. Absent from every single dental school curriculum taught after 1980. Number 21, oregano oil, carvacrol, and thymol, the 2 phenolic compounds in true oil of oregano, have documented antimicrobial activity against Candida, albicans, Staphylococcus bacteria, and certain respiratory viruses. A 2016 study from Georgetown University Medical Center confirmed that Carvacrol directly inhibited norovirus replication in laboratory conditions. Oil of oregano is sold in any health food store for $15. It is mentioned by exactly 0 pharmacies. Number 22, licorice root, Glycyrrhiza glabra. Used continuously in traditional Chinese medicine for more than 2,000 years to treat ulcers, adrenal fatigue, and chronic respiratory inflammation. A deglycyrrhizinated form called DGL is used clinically today for peptic ulcers, with effectiveness directly comparable to proton pump inhibitors. Proton pump inhibitors generate over $10 billion a year globally. DGL costs $15 a bottle. Number 23, witch hazel, Hamamelis virginiana. The bark extract was used extensively by the Mohegan and Iroquois peoples for bruises, inflammation, and minor wounds long before European contact. It remains one of the very few botanical substances the Food and Drug Administration still classifies as an approved topical astringent. Your grandmother wiped every cut with witch hazel before putting on the bandage. The infection never came. Number 24, peppermint oil. A 2007 German double-blind clinical trial showed that enteric-coated peppermint oil capsules were as effective as the prescription medication mebeverine for irritable bowel syndrome. Peppermint oil capsules, $12 at any pharmacy. Mebeverine, prescription only. The study exists, it is published, it is peer-reviewed. The prescription habits of American physicians did not change. Number 25, Activated charcoal. This one is critical. Activated charcoal is still the first-line treatment for most oral poisonings in every single emergency room in the United States. It absorbs toxins in the gut before they reach the bloodstream. Your great-grandmother kept a jar of activated charcoal on the shelf for food poisoning, accidental ingestion, and severe diarrhea. The modern hospital uses the exact identical substance at over $500 per single administration. You can buy the same activated charcoal at any health food store for $15. 25 remedies. Every single one with a documented history of use, spanning hundreds of years. Every single one with at least one published, peer-reviewed study confirming its biological activity in the human body. Every single one cheaper than the pharmaceutical equivalent by a factor of 10, 50, sometimes 500. None of them are taught in any American medical school today. This is not an accident. It is the predictable outcome of a system where anything unprofitable is, eventually, treated as if it does not exist. This knowledge did not disappear on its own. It was suppressed, ignored, erased from curriculum after curriculum for decades. But it still lives. In every single video on this channel. If this video made a real difference for you, subscribe and share it with someone who desperately needs this knowledge. Every single share keeps alive what the industry spent 100 years trying to make you forget. The next video opens the next chapter. 7 European medicinal plants that practicing herbalists in France and Germany still refuse to name publicly on camera, and the specific reason why. Subscribe so you do not miss it. But before the next chapter, take one more minute and reflect. You just heard 25 remedies your own family once used. 25 that vanished in a single generation. Think about what else vanished with them. Think about what your children will never be taught if this knowledge is not handed forward. Your grandmother did not have a medical degree. She had a lineage. Grandmother teaching mother, teaching daughter. A chain of practical healing knowledge, thousands of years long, severed cleanly in one single century. It was not severed by ignorance. It was severed by commerce. But the chain is being rebuilt, one viewer at a time, in the comments and in the community below this video. Every single person who shares this video is a new link in that chain. And the chain does not break again while we are watching. This knowledge does not belong to the industry. It never did. It belongs to you. It belonged to your grandmother and her grandmother before her. And now it belongs to whoever is brave enough to remember. Subscribe to Green Vault so no one anywhere ever forgets it again.